Digital health technologies is a large term that encompasses lots of things, from mobile technologies, from smartphone-based and app-based to wearables, as well as the data infrastructure underlying a lot of those devices. Over the last few years, particularly with the technology revolution in terms of smartphones and a lot of other, the ubiquitousness of a lot of these ubiquity of these technologies, a lot of people are now trying to think about, are there ways that these technologies can be used to improve health? The challenge that I've seen in terms of the adoption of these technologies is that they've been primarily technology driven, meaning that I have a smartphone, what can I do with it to improve health, as opposed to what is the problem that I have, and is a smartphone or an application or a wearable the best solution for that problem? So if we look back over the last few years in terms of the adoption of technologies, a lot of the wearables and other things have ended up being less about getting unwell well and more about getting the fit fitter, at least from my perspective, because the challenges in delivering healthcare to people who have medical issues is much more complicated than a consumer making a choice in terms of what phone to buy or what TV to buy. So I think going forward, as people have realized that while there's a lot of things we can do with engineering and data and electronics, it has to be put in the right clinical context. So one of the things that we do at Stanford in the Stanford Biodesign Program, which is really a program focused on how do you understand unmet medical needs, is take that approach of let's figure out what are problems to solve, and then add to the toolbox of solutions all of the new technology that have come online recently, which includes a lot of the things I've been mentioning, like smartphones, and then from that full toolbox, see if they're the right ways to solve a problem. So going forward, I think the marriage of a good understanding of clinical problems based on the role that physicians and allied health professionals play in really seeing what goes on in the medical space and healthcare space, the preferences and the realities of what patients have to go through, which is becoming increasingly important as we move technologies and move care out of the costly settings like hospitals to the home, in which patients actually have to do a lot more, but really understanding that life is not so simple as I prescribe it to you and you use it, but I have 3 jobs and I live near 4 really cheap, high-calorie food outlets, and that's what I do, and I don't have time to exercise. Those are important realities in terms of delivery of healthcare. And then finally, the payment system, how payment and how reimbursement will be able to support a lot of these technologies. Only with a full understanding of that, and then merging that with kind of the thought processes that engineering and data scientists and folks in the world of development can bring, putting those together, which is something we do a lot of at Stanford Biodesign, will we really be able to frame problems properly such that the right digital health solutions will be applied to the right patient populations whose incentives and motivations are aligned to actually make an improvement in what happens to them. I think the other thing that's happened over the last few years has been an understanding that, unlike perhaps in the consumer or tech world, in which a lot of things are personal preference and you buy it and you use it, that model may or may not really be applicable to healthcare, in which data that's gathered from devices or other types of services actually has both potentially positive, potentially negative consequences depending on the pretest probability of what you're looking for. So I think, just like all good science, a lot of these technologies will have to go through rigorous clinical evaluation to prove their value clinically, meaning that it's not just that they do what they say they're going to do, but what they do results in some sort of outcome, data, information, that then leads to a change in management that's of clinical utility to the patient, and more importantly to the healthcare system as a whole, that this is economically viable. Because again, unlike people buying things for their own use, a lot of patients have difficulty paying for their own healthcare, particularly with healthcare premiums and all the rest. So the model of how things have to be promulgated in the real world is going to be much more like it's always been. Good science, good trials, good understanding. That being said, I think people have tried to get around that in a lot of ways by not trying to go to the consumer first. But as I mentioned, consumers, while they might think they want to participate in healthcare and behavior change is really hard. And just because you have an app doesn't mean you're going to walk. And just because you have something that tracks your steps doesn't mean you're going to do it. What are the right incentives to get you to do that? And that is a complex interplay of support structures, insurance incentives, workplace incentives, as well as an understanding of the realities of kind of what people live through every day. But that's much more complex than a hardware solution. So I think showing value in all of those contexts by understanding what you need to show and what the technology needs to do is where digital health has to move to really meet the promise of what a lot of the hype has been for the last few years. Cardiac arrhythmias are things that oftentimes present with very vague symptoms. Oh, I felt my heart racing for a few seconds, or I felt lightheaded, or I passed out. But then you get better and you don't feel them for a while. So what typically happens is when we started really looking at what happens to patients is that they often tell their primary, maybe go to an emergency room, or they keep telling people, but they're not at the time unwell. So it's more like, well, we'll see what happens. But when you actually trace this odyssey, they oftentimes get different types of tests which are not aligned to how frequent they have their symptom. It may not be from the right physician, or they may have to be referred all the way up to a cardiologist. So when you actually add up the time as well as the cost of the multiple tests, it's very significant. So we realize there's got to be a better way to monitor non-hospitalized patients, ambulatory outpatients, who are suspected of arrhythmias. That's where we started realizing that also, if you're going to do this and make it valuable for the patient, you really need to think about them. Patients really hate carrying around things that let others know that they might be sick or that there's something wrong with them. So a lot of these things which seem at first not that important are actually what drive compliance. So with that, we invented this thing called the iRhythm Zeo patch. It's a 14-day continuous monitor that you wear and you sleep with it and you shower with it, and it records everything, and it's a single-use device, so you can be deployed in any clinical setting, out of a Pyxis, in an office, very easily, very much differently than the standard model, which is of a lot of reusable devices which you have to get in certain labs, etc. The idea was to lower the barriers to access so that when a person first presented with a symptom, they could begin the monitoring process. But again, that solution, we didn't go into this process saying like, we're going to invent a patch. It was more like, here's the problem, and out of all the solutions we had, this idea of a simple, very user-focused, user-centric patch is what came out. Now, that's only one part of the solution. I think the other thing that digital health products have to understand is they have to make solutions, not products. So to really deliver a diagnostic solution requires a data system, a service to really encompass everything that you need. So we realize, hey, it's great that we have this really novel device that can record all this in an easy way for patients to live with it, but then what do you do with all that data? So we realized, well, for the physician, it's a lot of data. How do we go through it in a very scalable way? So we developed a very sophisticated cloud-based algorithm and analytics platform, and a very user-focused, but in this case the user is the physician, to look at the report to really understand quickly what arrhythmias exist or don't exist, such that what we wanted to avoid was an internist prescribing one test, but that didn't contain the data that an electrophysiologist need. But an electrophysiologist could look at that report and say, like, I have everything I need, but it's not scary for the internist who might just be able to, like, oh, I need to refer it to a specialist. So a lot of focus on that, but then all of this has to be supported by how do you do this? How do you support the devices, the data download service? So I really think about the approach we took in solving this problem as we needed a novel device. It's really, we developed an IT company that's enabled by a novel device but supported by a service. So to date, that company, we've done almost 400,000 patients. We have over 90 million hours of curated, annotated data. And the value of that data is not, the value of the product is the patient experience and the data we're collecting, but the data we've collected allows us to analyze and show that, yeah, recording longer does find things of meaning. We're reducing unnecessary tests, et cetera. So the value of the data is that we're now being able to, we had a paper with 26,000 patients, we had a paper with 3,000 pediatric patients. We can look across this stuff because that's where the data is valuable, because it proves the clinical utility. And then over time, the data can help us improve our algorithm performance, et cetera. So that's an example of here's how you solve a problem by understanding the problem first, not saying I have a technology and then making sure the problem fits it. So I would say for physicians or anyone interested in developing new technologies, really go back to focusing on the problem. What is the problem you're solving? Can you articulate it? Is it something that other people would resonate with if you're talking to physicians or payers or whoever your stakeholders? Don't get enamored by the technology. We can do a lot of things with technology. The real question is, should we? Is it important to? And are we doing it in the right population? Because again, as you start moving towards consumers and healthier people, you increase the rate of false positives. And false positives in medicine, or what we like to call them as incidentalomas, you'll find stuff that are incidental that lead to things that both can help but also might harm. So it goes back to good principles of medicine. Do no harm, but that means sometimes really being cognizant of not what technology can do, but really when it should be applied and to what problem, and to whom.